No more heavy period. Menorrhagia. Menorrhagia is defined as menstrual bleeding that lasts for 7 days or more, and the degree of heavy menstrual bleeding is defined as a sanitary napkin or tampon that completely soaks through within 2 hours and needs to be replaced. About 1 in 5 women suffers from menorrhagia. Academically, the loss of approximately 60 cc to more than 80 cc of blood per month is also defined as menorrhagia. Possible causes of heavy menstrual bleeding. 1. Hormonal imbalance. If there is a hormonal imbalance, the endometrium will be produced more, and then it will fall off, which will lead to excessive menstruation. 2. Uterine fibroids. Benign tumors in women of childbearing age. These uterine fibroids may cause prolonged menstruation or increased bleeding. 3. Poor ovarian function. It may cause prolonged menstruation or increased bleeding. Girls who are going through menopause and those who are about to go through menopause are more likely to encounter this situation. 4. Uterine adenoma. When endometrial glands infiltrate into the myometrium, it will cause the uterus to become round and large, often causing heavy and painful menstruation. 5. Uterine polyps. Uterine polyps are caused by the overgrowth of the endometrium, which may lead to symptoms such as non-menstrual bleeding, heavier menstrual flow, and longer menstrual periods. 6. Endometriosis. This condition causes the lining of the uterus to grow outside the uterus, causing menstrual cramps, pelvic pain, heavy periods, heavy menstrual bleeding, and irregular menstrual cycles. 7. Intrauterine contraceptive device. Generally, after the intrauterine contraceptive device is installed, the duration of menstruation will be 2 to 3 days longer than when it is not installed, the amount of menstrual blood will increase, and the menstrual period will be more irregular. 8. Blood coagulation diseases. For example, hereditary hemophilia. Due to the congenital lack of coagulation factors, platelets cannot coagulate blood normally, resulting in symptoms such as prolonged menstrual bleeding or excessive bleeding. 9. Thyroid disease, liver disease, and kidney disease. These diseases may cause hormonal imbalances, causing symptoms such as heavy menstruation and irregular menstruation. 10. Pelvic inflammation. Pelvic inflammation is a common gynecological disease. It is mainly caused by bacteria running into the vagina and entering the pelvic cavity through the cervix and fallopian tubes, causing pelvic inflammation. 11. Complications of pregnancy. When any woman of childbearing age has abnormal first blood, she must consider possible complications related to pregnancy, such as miscarriage. 12. Cancer lesions. Cervical cancer, endometrial cancer, ovarian cancer, leukemia and other lesions may also cause excessive menstrual flow. 13. Caused by drugs. Analgesics, anti-inflammatory drugs or anticoagulants can all cause excessive menstruation.